Hello, I am HealthtalkwithTinuO. I welcome you to your Health Matters with HealthtalkwithTinuO. Today I have Dr. Ash here and we will be talking about the pain management. We want to know the best method to help people to cope with whatever pains they're going through. If it's backache or spinal injury or head injury, Dr. Ash is the head expert who would explain all that to us. Now let's start by headaches. We know that with headaches there is muscle tension that can cause headaches. And then there's something called tension headaches. We have episodic headache and chronic headache. With episodic headache, that occurs when you're hungry, when you're angry, when you're stressed, when you're tired, when you've lost sleep or depressed or stressed to suffice. But Dr. Ash would explain more on that topic. Also, we want to talk about chronic headache that occurs about 15 to 16 times a month over the period of 3 months. And that could make you feel queasy. Now we're talking about spinal cord injury. But before we go there, the doctor would like to explain to us more about that kind of injury that could lead to disability. You know, sometimes you could just hit your head somewhere, you don't know what has happened. Sometimes the headache might not be minor, it might even be a tumor, but the doctor will let us understand the signs and symptoms and treatment as well. So when we go down to spinal cord injury, the doctor will explain what stimulation is all about. I think it's something like a stimulator is more like a device that heals pains, but the doctor will explain more. I welcome Dr. Ash to your Health Matters, and thank you for coming. Dr. Ash, and I've been trying to get you before the lockdown.
That's correct.
So at least it's a great opportunity to be here where we are, and sad that so many people lost their lives. So during the lockdown, how did you cope?
It's been a difficult 2-year period, and being in the healthcare, or even if you're a public, you've seen the ire of this pandemic. We've lost a lot of our patients, our colleagues, and people we might not know, but the cost of this has been huge in terms of what it has done to the society as a whole. But we can also see a silver line in all this. The healthcare had advanced. People have been more aware of their health needs. What we took for granted, all of a sudden, health became the #1 issue in our lives. And this was largely because of what we saw going around us. And in the healthcare, we coped by switching on to the digital way. I mean, we started doing teleconsultations, seeing patients on video, or talking to them on the phones, which was frowned upon prior to the pandemic. The patients accepted this way of consultations. In terms of the technology took a huge leap. Probably we've grown about 5 to 10 years within a period of 6 to 18 months. What was thought of a futuristic way of medicine suddenly happened within months.
Certainly.
Correct. And I think we need to move forwards and onwards.
That's true. That's good. A bit of a mixed, situation.
Correct.
And we're going to start by talking about tension headache. I have never come across any human being on this planet who says, I have never had a headache. I have never had a headache in my life. Everyone has headaches, even babies. So what exactly is this muscle tension that leads to headache? Or are there other, factors that cause headache?
Sure. I think most of the modern medical problems are probably in some way related to stress. And these are, I'm talking about the symptoms. Pain, aches, headaches, even things like back pain. So stress plays a huge role in our lives. Sometimes the stress we take, the worry, protects us, and sometimes it probably destroys us.
Sorry, let's stop. Sorry, when you hear noise, please, we're going to stop and then we start. Don't worry, we're going to edit it. So, sorry, it takes place. Go.